All right, good afternoon. It's 5 o'clock, and like every day, we are now once again gathered together to give an update on the coronavirus, but also to recommit to doing everything it's going to take to protect those around us. And let's start the way we always start, by saying that we will get through this. We will get through this together. All right, so everybody, we will get through this. We will get through this together. One more time, it helps when we say it. We believe it and we know it, but it still helps when we say it. We will get through this. We will get through this together. And we will get through this because we will follow the 10 steps to making sure that we defeat this coronavirus. Those 10 steps, which we've tried to distill and make it easier as we go over every day, and which will, when James pulls it up, will be up on the screen. We're helped by James today, along with Virginia. I'm going to try to do them by memory. Our 10 steps are about, number one, engaging in social distancing. Social distancing is our most powerful tool to reduce our number of contacts and to ultimately reduce the spread of this virus and to ensure we have the healthcare capacity that we need. Number two is avoiding crowds, any size crowd. It is our job to make sure that we do not go towards or participate in any crowds. I should have started with the very first is healthy at home. That's the place that we need to be. Unless you're going to work, getting exercise, or going to the grocery store, folks, you've got to be at home. It's the healthiest place for you to be with your family to not get this virus. It's also the healthiest place and the best decision to make sure that we are not spreading it to the most vulnerable. Number four, knowing when to seek care. This is going to be absolutely critical, especially as we continue with the surge of cases. That if you are well but nervous, that you do not go to a healthcare facility so that you are not overwhelming it. You call the coronavirus hotline, which is on the website. Number two, that if you are sick but might not have sought care but for the coronavirus, you call. You do not go to. You call your primary care physician or a physician or a physician's office to first talk to them about why you are seeking care. But third, if you are truly sick or if you are injured, that you get the care you need. This is going to be so important going forward to make sure we have the healthcare capacity to help those that need it the most. Number five, kycovid19.ky.gov. That is our website. That is the source to get the truth, accurate information, all of our recommendations. You know, every day I receive texts or calls with the newest rumor that's out there. Rumors are never true. Make sure that you go to the source that you can count on, kycovid19.ky.gov. Number six, wash your hands. Wash them a bunch. Wash them for at least 20 seconds with soap. Continuously wash them throughout the day. If you can't find hand sanitizer, though we're going to be providing a lot of hand sanitizer thanks to our distillers and a number of other companies across Kentucky, it is better to use soap and water. Make sure you're disinfecting surfaces. Either use something that you can get at the store or use the 1-100 bleach solution. Do it at least once every single day in your home, certainly at work if you have a workstation. Number seven, apply for benefits. Today we're going to have at least 5 minutes with Josh Benton talking about a number of the upgrades that we are making. I'm going to go ahead and I'm going to ruin his thunder and say that last night we sent over 40,000 acceptances for benefits across Kentucky, many of which went to people that the website had originally told them did not qualify. So I'm going to let him explain what we're doing and where we're going. But for those of you out there, be patient with us. I believe that you will get results if you're patient with us, even a little faster than you might have anticipated. But we have a volume right now, first that we want, because we want to help everybody to get through it, but a volume we've never dealt with. And so work with us as we get through it. We're going to make sure that we take care of everybody. Number 8, prioritize your mental health. Now, we're in a key set of weeks and even a month. And listen, the days are going to get long and the weeks are going to get long. But we got to come out of this strong, and we need you to be healthy at home, mentally, physically, and emotionally. Because I'm going to tell you, it's going to be a beautiful weekend again. And we cannot repeat last weekend where we saw a lot of crowds come together. And so as the weather gets nicer, I need you to be even stronger to make sure that we're doing what it takes. And we're going to talk a little bit today using some of the White House's projections about what that means here in Kentucky. Number 9, don't travel. Don't travel anywhere. Nobody ought to be traveling. It's not just our prohibition about other states. It's that the only traveling you should do is if you're going to work or if you're going to get supplies. Don't travel. Be healthy at home. And number 10, when you see something that's dangerous that's out there that could be spreading the coronavirus, let us know. All right, so those are the 10 steps to addressing the coronavirus. But I'm going to give you a +1, which is about what we need to do to make sure that we have all the help we need, or some of the help we need, coming out of this. And that is complete the census. Folks, if we're healthy at home, we have plenty of time to complete the census. After all this is over, the census and how many that we have sent back in is going to set how much federal aid we have in a number of key critical areas. We talk about your social distancing being your patriotic duty as an American and a citizen of the Commonwealth. So is the census, and this is going to make rebuilding and restocking and moving forward much easier if we have everybody, and I mean every household across Kentucky doing this. This will help. All right, so in these challenging and trying times, when we want to be mentally, physically, and emotionally healthy, one of the best things that we can do is model that behavior. That's why I've been asking you to use hashtags in filling up the internet and social media on the types of behaviors that we want to see. We've asked you to use the hashtags Team Kentucky, Together KY, Patriot, and Healthy at Home. And we need you to keep doing it. We need you every day to try to fill this up. Because as other people out there are looking at what their neighbors are doing, this is an important, positive, social peer pressure to try to make sure that we have everybody wanting to do the right thing, because that type of encouragement is going to get us the better compliance that is going to protect more people. So let's look at a few of the things that we have today, and then we'll move into some of the additional points we're going to make.
Well, good. Woo! This. Me. Well, good. Through. This.
These are some of our amazing Kentuckians. These are amazing children that are out there fighting every day to do everything that they can to defeat this coronavirus. Also, some that might be vulnerable if the rest of us do not do what we need to do to battle this coronavirus. And remember, we'd like to see videos of you saying it too. We will get through this. We will get through this together. We believe it. We're committed to it. And we appreciate these kiddos helping us to spread that message. Just a few more. We appreciate all the chalk drawings that are out there. And it's been amazing to see the art as it's grown. I will tell you that this positive example works. My daughter has been out doing it herself, about being healthy, about being together, about the things we need to do. Again, here are folks helping out with PPE for first responders. And let me say, the first responders appreciate this. They appreciate the meals. But the number one thing they would ask you to do is to be healthy at home. The number one thing you can do to help a healthcare provider, though we will take any PPE, but the number one thing that you can do is to make sure you're following all the rules and the recommendations, because the more this virus spreads, because people don't do it, the more our healthcare workers are exposed to it. And let me thank those healthcare workers. They are heroes. Let me thank the grocery store workers, everybody involved in the food supply chain, how important they are right now. Our police, our firefighters, our EMS, our social workers. who are out there still having to make house calls in the most dangerous situations, thank you for what you're doing, and for so many others that know that they are likely exposing themselves to this virus, but are doing the right thing anyways. All of our folks that are making meals at schools or in other places, thank you for what you're doing. And you know what? Our kids see it, and they appreciate it. They love what you're doing. You're heroes to them, too. And this is something that I saw that hit me as a parent. I have the days where my kids so desperately want to do some things they can't do right now. And while those are hard conversations, and while those sometimes result in kids that are upset and it hurts and you feel it, it's not just what's in their best interests. It's what's often in their grandparents' best interests. And so many that have gotten this virus aren't just in those senior years. It's everybody, and it can harm those in other age groups. We do need to remember that. All right, this is Woodford County Cooperative Extension Service doing two things that are important. Number one, they're wearing green. It's a color of compassion that we are wearing to honor those that we have lost. And number two, they're engaged in a virtual meeting. That's what we need to see. Every meeting needs to look like this. Again, here is a donation from Gray Construction of 3,000 face masks in the Lexington area. For everybody who is helping out, thank you, and keep looking. Keep looking. Every single bit of PPE, especially that is medical grade, every industrial N95 respirator that we can find, every single one of those will make a difference. And I'm asking any Kentuckian that has them to donate them. We're going to need them. And these are just more Kentuckians every day that we see coming together, lighting their homes up green, telling people that have lost a family member during this that they are not alone, and that we all feel for each other. When we lose a Kentuckian, it's a loss to all of us. Thank you to the Glasgow High School softball team for, again, taking the time to do something like this, showing that you can be creative while this is going on, but also being a positive example for their peers of what we need during this time. So, we are in the surge. We know we're in the increasing the escalation of our curve, and the next couple weeks. And in fact, this entire month is absolutely critical. We need everybody to give everything they've got during this period of time. Remember, we typically see the ramifications of how well we're doing about 2 weeks later. And I will tell you, our actions, our aggressive actions, and everything that you all have sacrificed is making a difference. It is making a difference, but that doesn't mean we don't have to dig a little bit deeper, especially during this period of time. So we got 3 primary ways that we attack this coronavirus, that we protect each other. Number 1 is social distancing. It's all these steps we're taking about being healthy at home, about shutting down forward-facing businesses to in-person traffic. It's all the sacrifices that you all are making. And this is the one part that is entirely in our control, where we as Kentuckians, without any help from the federal government or anybody else, can slow the spread of this virus, can make sure we have the healthcare capacity we need by decreasing the number of cases over time, or at least lessening them. This is the best way that you as an individual can help in this fight. I know it feels like this is all out of our control. This is a virus you can't see. and it's going on around us, and you're just at home, hopefully not just sitting at home doing all the things that you need to do to stay healthy, I know it can feel out of your control. It's actually more in your control than most crises that we face, because your actions, your choices, can reduce the spread of the virus from you, and ultimately, if we can do it collectively, can flatten that curve. You have more control than what you think about how we address this virus, and I need you. We as a state need you. Your actions are so important. Number one is social distancing. Number two are our steps to increase our healthcare capacity. Let's show the slide on the number of beds and ICUs and ventilators. This is one of the things that we in the Department of Public Health, the National Guard, our emergency management, work on every single day. This is our numbers before we start working on them to increase that healthcare capacity. We want to increase that to make sure that when we see the surge, that we can help everybody who needs their help. On hospital beds, our current planning could have us growing right now. I feel pretty comfortable about 8,000 additional beds. That's a start, but we still have more work to do on top of that to make sure we can get where we need to get. That includes about 1,600 beds and growing that we will get from hotels that we currently have under contract for more low acuity centers to help us increase that capacity. But we're working every day on that piece. Number two, and they're really connected, is ventilators and ICU beds. You know, the ICU beds have more things than they need than a ventilator, but the ventilator is really important to that. As I've said before, right now I'm comfortable that we've increased our ventilator capacity by about 70, but we're out there working on a goal of trying to double our number of ventilators. They won't be hospital-grade ventilators, but we need to make sure we have what can work to help people through that period of time where they need it. So number one, what's totally in our control is our social distancing, the aggressive steps we're taking to reduce our contacts. Number two is everything that we and the healthcare community and others, the hotel community and others that we're going to ask, can do to increase our healthcare capacity. And number three is testing. Again, we are pushing, and we're pushing every day to try to increase our testing capacity. And overall in the state, our testing capacity has certainly increased. In fact, we are running an audit through the governor's office with outside labs on testing that's been done to date. And we don't have all of them in, but we can now confirm over 10,000 tests have been run in Kentucky, and we still have a number of labs to still come in. So that projection that we've been giving, we are certainly in that ballpark, and we hope to have very firm numbers. Hopefully tomorrow they'll be current as of today, but making sure that we have the right numbers to provide. We are working on everything we can to increase that capacity. I will say that every 2 steps forward, we do have a step back, and oftentimes that's because the testing kits and the personal protective equipment that we expect to come to us is diverted and routed somewhere else, or that the agreements are in place, we should have them, and a couple days before, it just doesn't happen. This isn't just happening to us, it's happening all around the country, and all I can tell you is we're scrapping for it every day. I hope here in the next couple days, though, to have a positive announcement about increased capacity thanks to a newer lab that is here in Kentucky. Also want to mention UK and U of L are both ramping up their capacity. Mentioned U of L yesterday, but Kentucky is working as well on ramping up each and every day. So these 3 areas, and I want to talk about why they're important: social distancing, increasing our healthcare capacity, and testing. I want to talk about in terms of the graph we always look at. Let's start with the animation on Philadelphia, which we show. All right, social distancing. Social distancing is the key to make sure that we don't have the spike that Philadelphia had, where they overwhelmed their healthcare capacity during the Spanish flu, and they lost a lot of people. That's why we do the aggressive steps that we are doing. That is why we are engaged in the social distancing. This is why we're making the sacrifice that we are making, and so many of you are making. Social distancing is how we prevent this. Let's show St. Louis. So the first curve on St. Louis is the example of why we would do social distancing, so that we decrease that spike and we ultimately have a lower initial surge. Healthcare capacity and increasing it is how we try to protect our people when the surge that we are in the middle of, and we don't know exactly how large it will get, it's all projections, but that we have enough beds for the full amount that we are going to increase. So our goal is to increase our healthcare capacity if we put it on a line that is above the surge that we expect to see. And then the testing, which we want to continually ramp up, but I will say it's going to be very important to try to do everything we can, and this is why Louisville's important, to reduce any spike or any reemergence that we see in the fall. Our hope is, at least by that time, that we will have the ability to identify, to isolate, and to contact trace in a way where that next bump that we have seen, that we can reduce much in the way that Louisville was able to reduce that final bump. So those are three critical ways that we address this, and hopefully that shows you why each one is so important. And let me mention that it's serious. I think we all know that now. Yesterday with our number of deaths that we had, I think we all know that. But I want to show the graph that the White House used the other day for the United States, where they showed a set of numbers. Let's do the bump where they predicted potential fatalities in the United States with and without social distancing. So this is what the White House showed the other day. And I will tell you that while we are still working on our modeling, we think that this is a somewhat optimistic scenario. Our concerns are that this virus can spread faster than this, and its toll may be greater than this. But this is the projections that they put out. They do have a lot of great scientists that are working for them. But I think that my concern, and many states' concerns, is that perhaps this is almost an optimistic scenario. Still, look at, first of all, the number of deaths without social distancing that would be expected under their model in America. And remember, not everybody out there is engaged in social distancing or significant social distancing right now. And look at their rate and what it would mean. And this is with significant social distancing for what the White House put up all over the country. They predict 100,000 to 240,000 deaths. So while we're still working on our modeling, which is going to have different assumptions and different projections, I want to just show you with the White House's numbers what that would mean for Kentucky. So based on their numbers, and without taking into impact the overall health of our people, but just based on our percentage of the population, this is what that would mean. That if we had not taken the steps that we have taken, if we had not done the social distancing that we are already doing, under the White House's scenario, adjusted by population, we'd be looking at 21,000 to 30,000 lives lost in Kentucky. Now, according to their math, with our social distancing, if we do it well, we'd be looking at 1,300 to 3,200. Now, two things about this. Number one, we believe that their modeling might be an optimistic scenario. But number two, I'm committed that we can do better on our social distancing. Even though when we were able to provide our modeling, I believe that our numbers will be tough for people to see. I'm convinced that they are only a prediction, and that we as a people are tough, we are strong, we are committed to do what it takes. But I, at least under this scenario, want to give you the reason that we're doing all these things, is that we're looking out for 1,300 to 3,200 Kentuckians that we love and that we care about. And so our decisions are critical. And when we make those decisions to treat a grocery store as a a social hour, when we make the decision to come together when we know we're not supposed to, that's the difference when we jump from the social distancing that's here to the no intervention, and we ultimately put more people at risk. So, folks, this is real serious, and I know you know that. We otherwise wouldn't have taken the steps that we have taken. I know you were ready for a slide like this, and you'll be ready at a later point when I show you a more pessimistic model. This is why we are doing what we're doing. We're ready for it. I know we can breathe, and I know we can commit to beating any model that we put out there. That's the type of people that we are. And I want to take a moment to talk about what happens when we don't engage in social distancing, when people violate the rules and the recommendations that are out there, and not only the harm, but the significant harm that it can cause. So I'm going to read, and it's slightly edited, some information from the Hopkins County Health Department. Hopkins County has been hit really, really hard. And we know the community is reeling. It's an important community to me. It's where my dad's from. It's where my family is from. Here's what it says. We had a church that had a preacher from Texas come down to Dawson Springs March 15th and 16th for a revival at another church. When he left, multiple families were sick. Church placed a post on social media that those people did not have the corona, they just had the flu. According to several people interviewed, they were encouraged not to self-quarantine and still come to church. They did not practice social distancing at the revival. Hopkins County now has 24 cases, hundreds of contacts, and 2 deaths with an epidemiological link to this revival. We've additionally had cases in Muhlenberg, Clark, and Warren counties related to it as well. Also, we have a nursing home with a case, a business with a potential outbreak from this one revival, a healthcare facility, and an ambulance service that has had multiple personnel affected, and we closed a hospital unit and opened up a COVID unit. This is spread throughout our community. So to anybody that is not listening to the recommendations, to anybody that's still trying to hold, it's not just a service, but a meeting. Notice what one meeting can do, and it spreads far beyond those that are there. Let me say, I think the folks in Hopkins County are doing an amazing job in combating the coronavirus. The judge executive and the mayor of Madisonville do an update every single day. I think they've been communicating well, and they've been communicating effectively. The public health department, the healthcare facilities are all working really hard. But because a couple of leaders in a different part of the community decided that they were going to ignore the guidance, they have put the entire community at risk. You can't be doing that. You absolutely can't be doing that. The ramifications when we don't follow this end up being widespread, and they hurt people that didn't make that choice. That didn't make that choice. And they potentially cut down on the resources to protect other people. So let's do better. Let's be better. And let's make sure that we're responsible in the choices we make to protect those around us. All right. So today's update is that we have 93 new cases today. And let me say that while 93 is a lot of cases, this is less than yesterday's. It doesn't represent a doubling of the overall number in the time frame that we're seeing in other states. So again, while we don't want any new cases, we know that there are going to be cases. But our rate of increase is lower at the moment than anticipated. And that's a good thing overall for our healthcare capacity. But we can also at the moment confirm 2 new deaths, and those are from a 60-year-old male from Davis County and a 76-year-old female from Hopkins County. I'm told Louisville announced one today. We haven't been able to confirm that. And so right now, what we would add are 2 which would bring our total number to 20. That is one less than some have reported. We had one in the past that was reported as a fatality that wasn't. So right now, as a state, we have 20. So tonight, let's make sure we honor the 2 Kentuckians that we lost today in Davis and in Hopkins County. Let's light our houses, our places of business, our universities, and everything else up green. We'll light the governor's mansion and the Capitol. But like I said yesterday, it means more that you do it. It means more because people driving around in the community will see it. They will feel that they are not alone. For these families, they will know that we feel, and we want to take a little bit of that loss off their shoulders and help them to get through this at a time where we can't go over to their house to try to help them through it. It's also a symbol of renewal, that while that person is no longer with us, their spirit is no longer contained by their body and going to a better place. I fully believe that. Of the 93 new cases that we have been able to confirm, 31 are in Jefferson, 12 are in Fayette, 8 are in Harrison, 8 are in Davis, 5 are in Kenton, 4 are in Warren, 2 are in Clark, 2 Pulaski, 2 Montgomery, 2 in Henderson, Madison, and Bourbon, and then 1 in Spencer, Hardin, Jessamine, Lyon, Christian, Menifee, Oldham, Nelson, Franklin, Anderson, Callaway, and Breathitt. But folks, it's everywhere now. I heard about a county today that said, oh, but this isn't in this county. Well, in fact, we know that it is. That while somebody was tested in a different county, that they lived in that one. And so if you hear from anybody that the coronavirus isn't where you live, it is. But all that means is everything we've been doing is important. And let me thank our mayors, our judges, our magistrates, our sheriffs, and everybody else, because in numerous places that haven't reported their first case, I see you already taking steps. And if you're taking steps to cut people's contacts, I got your back. It's exactly what we are asking you to do. But I know that your people are also going to understand and to support it. What you as Kentuckians can do to help. Number one, support your local businesses, order takeout. If you have local retail that is closed to in-person, if you can order from them and pull up on the side, please do everything you can to help people to get through this time. Number two, ring your bells at 10 a.m. I've loved seeing this out there on social media. I love how it's expanded beyond anything we could have ever thought. I'll tell you that our receptionist in the governor's office walks out at 10 a.m. every day and rings the bell that she brings right there in the Capitol Rotunda. Number three, follow the rules and be a good neighbor. I've said before, this is a test of our humanity. It is. Will we give up a little bit of what we like to do to protect people that we probably don't even know, but knowing that by not doing it, it could risk the life of another? That is our challenge. That is our question. I know we're going to answer it the right way. I know we're going to live up to that challenge. Use the hashtags Team Kentucky, Together Kentucky, and Patriot Healthy at Home, and set a positive example. And if you are able, help out with the Team Kentucky Fund. We have a video today from Coach Mack, the U of L basketball coach for the men's basketball team. We appreciate him sending this in.
Hey Card Nation, this is your head coach, Chris Mack. I trust that you and your family are staying safe during this unprecedented time that we're all experiencing, the COVID-19 pandemic. Many of our friends, neighbors, relatives are experiencing some of the toughest times they've ever had through the loss of employment. That's where I'm asking you to be a great teammate and give to the Team Kentucky Fund, set up by Governor Beshear and administered by the state of Kentucky. Your 100% tax-deductible donation will go directly to those families that are mostly in need to help them buy groceries or pay rent during this awfully tough time. Please join me in going to donate.ky.gov. That's donate.ky.gov and give what you can. In the meantime, I want you to practice safe hygiene, make sure that you're keeping socially distant. And at the same time, if you're sick, by all means, make sure you stay home. March is usually our time to shine. Join me and Kentuckians around the state in doing that once again. Go Cardinals and go Team Kentucky.
All right. Thank you to Coach Mack. And I also just want to mention that if you've seen social media, you know that Coach Mack is currently out of state. He has agreed to self-quarantine for the 14 days when he comes back. And what an example that sets. And if he's willing to do it, we all ought to be willing to do it. Next thing that you can do, get ready for this weekend. I'm going to tell you it's going to be beautiful outside, and we cannot have a repeat of last weekend. And we have had good partners in getting out the information we need from our partners in the media, and we appreciate you. But I got a challenge for you, and I need your help if you're in the media this coming weekend. I'm going to ask that every single reporter, anchor, otherwise that's out there, makes a video for their social media before this weekend, encouraging social distancing, getting out any personal message that they want, because every single one of you has a different following that is out there. We cannot let a beautiful weekend ultimately harm the people around us. You all communicate for a living. We've appreciated everything you've done. My challenge to you, and you got 2 days to do it, is to get that message out. Let's blanket it across the Commonwealth. If you want to speak directly to the region that you're in, that's great too. There is no script other than speaking from your heart and working to protect the people around you. All right, next topic we're going to address is unemployment and unemployment claims. We've got Josh Benton. He's going to do about 5 minutes because you're right, we've received a number of complaints because we haven't been able to move fast enough. That's on us. It's an unprecedented time. It's an amount of claims that we've never seen before, but you know what? It's our job to fix it. And it's Josh's job to fix it. So he's going to come up and tell you how we're doing that.
Thank you, Governor, and good evening, everyone. The governor's right. The last couple weeks on the unemployment insurance side have definitely been unprecedented, but I want to talk through a little bit some of the things that we're doing to address the issues that we're having out there, but also share a significant amount of good news that's taking place on this front as well. So I think the governor mentioned yesterday that the UI system is a legacy system. What that really means is that it's old and hard to change. And when you're really looking at it, it's a challenge to make all of the modifications to that system at the same time. We know what needs to be changed, and we're working diligently to do that. So the first thing we did was make sure that those individuals that we expanded coverage to were able to submit an application. And they were able to do that even though they were receiving messages that said that they were ineligible. We were able to capture that information and process it behind the scenes. I'll talk about the status of that in just a moment. The other significant challenge obviously has been communicating all of the changes that have been taking place. Whether that's our phone lines, whether that's on our websites, that it's been a challenge to consolidate that information. We did take a couple of steps this week. One is to revamp our kcc.ky.gov website that now houses all of the latest and greatest information on unemployment insurance, all of the updates, all the changes to who's eligible, who you can call, how you can submit a claim, how you can check your claim. All of that is now in a centralized location. We're working to disable the pages that just quite honestly don't matter right now because there have been so many changes to the program, and we're taking those offline so they won't be confusing folks. The other, which I think has been the biggest communications challenge, is our phone lines. Typically, day in and day out, we have 12 people in a normal situation that take about 1,000 to 1,500 calls a day. Obviously, that's changed over the last couple of weeks. We've increased staffing. We're well over 120 staff on the call center line now. But in the past 3 business days, we have received anywhere between 80,000 and 200,000 calls on that line. And it's, we know, causing backlogs and hold times that none of us want to see. We're working with additional vendors to come online with us so that we can have a variable call center workforce to help answer the calls, answer the questions as best they can, and get people pointed in the right direction. We know that that's an issue, and we're working every day to solve it. In addition, on the call center, I think just some requests for those out there. Now that we've centralized the information on our website about eligibility, I'll talk about some other changes here in a minute where you can find information. Also, we have the latest and most up-to-date information going out on our social media platforms, both through the Kentucky Career Center and the Education and Workforce Development Cabinet. So you can get that latest information. But we would like you to prioritize who's calling. There are some people that need to talk to someone to be able to file their claim. Those people are individuals who need to reset their claim or reset their PIN, or it's someone who might be having trouble with the online application that needs assistance. That can be a variety of issues, whether it's technology assistance or in some cases there might be a disability involved where we need that person to call in and communicate with us so we can help them file their claim. So we want to prioritize those groups of people. That those are the ones that need to be calling. We need to be able to communicate with those folks over the phone. To just check a claim, to check a claim status, that can all be done through a claimant's online portal that tells them when they qualify to request a benefit payment and that sort of thing. So please utilize those online resources to get the most accurate information so that we can reduce the volume on the call center line. We're going to be staffing up every day to make sure we can take the calls, but we really need to prioritize those specific individuals. The second piece, as I alluded to, was our system, the legacy system, the old and hard to change system. With all of the changes, we had to prioritize what we changed first. And so what we did was we prioritized being able to capture the information of specifically individuals that don't typically qualify. As I said, they were still receiving those messages that they were monetarily invalid or didn't qualify. We pulled those offline and were able to process those manually. The governor referenced earlier that there were upwards of 40,000 notices that are going out starting last night to those individuals who received those notifications, explaining to them that they have been approved and that giving information on how they claim and when they're going to be receiving their payments. They're going to be approved under the newly CARES Act, the newly approved CARES Act that came out of Congress with that funding stream. And so they will be receiving information about the pandemic unemployment assistance resources that are available to them. Additionally, we are connecting their updated information on their claim to their online dashboard. So by the end of the week, all of those folks are going to be able to see on their online dashboard what the status of their claim is. One additional piece of information to remind folks is that if you are filing a claim, your first payment is automatic. So we're getting a lot of calls in asking, how do I request my payment and that sort of thing. It's automatic. We're processing those as of today, Sunday, Monday, and Tuesday. We processed over $18.5 million worth of claims to over 32,000 Kentuckians that filed for unemployment insurance the week of March 16th. That was the first week that we saw significant claim increases, and those individuals are starting to see those payments come into their account. We have 3 more days today through Friday when payments will be made. So that will continue. That first week, that first payment, does not have to be requested. It's something that is just going to be automatic. Something that really epitomizes Team Kentucky, I think that's really important to point out, is that we have really taken an all-hands-on-deck approach in the Education and Workforce Cabinet and really across state government to address UI. Not every claim that comes in is perfect, and it has to be reviewed. It may have to be cleaned up. We have help from 3 different state agencies and the governor's office who are working to review those claims. In the last 10 days, that group of about 150 people have reviewed and processed 70,000 claims so that they can be paid out on time. They've done a phenomenal job of getting brought up to speed very quickly on what they need to review so we can make sure that UI payments are going out in a timely fashion. Just a couple of things to remind folks of too. When these type of large-scale layoffs are happening, it's ripe for bad actors to try to scam people. And it's a reminder to individuals on UI that if they're getting a message that is not coming from a ky.gov email address, it's not from us. Don't respond to it. Don't provide any information to it. And also, we're not going to call you and ask you for money, ever. So don't provide any information to anyone that's asking that. We know those things are going on right now, and they're trying to scam people who are eligible for UI and leading them down a path that's essentially stealing from them. It is stealing from them. They can report that to the Attorney General's scam hotline and make sure that that gets reported. But if it's not from a ky.gov website or email address, it's not from us, and we're not going to call you and ask you for money. You can be assured of that. So a couple of additional things just for everybody to keep in mind, because we're getting a lot of questions on these things as well. I mentioned the CARES Act. That did a couple of things for Kentuckians on unemployment insurance. One, it automatically extends benefits for 13 weeks. So if you are on unemployment insurance right now, or you're about to be, or your claim was exhausted on or after January 27th, you will receive an email from us explaining how to reopen that claim and extend it. So that's coming. It should be coming by the end of the week. In addition, the additional $600 a week that is going to be added to everyone's claim. That will be beginning to be processed as soon as we receive guidance from the federal government on the funding stream and when it's going to be coming to the states. Starting March 29th, it's eligible. So if you were on unemployment insurance on March 29th, that week is going to be your first eligible week. So potentially, the payments that come out next week could have it if we receive the federal funding stream. So that's something to keep in mind. That's coming. We will let you know when it's coming. We'll make an announcement that says that the $600 are being included. But just to close, we know it's been challenging. We know this has been difficult, especially for folks trying to call in, especially for folks that are having trouble applying. We ask those that are using the phone lines to use our online resources to get the most up-to-date information, and reserve the phone lines for those that are trying to update their PINs, that are having trouble filing a claim and need over-the-phone assistance. Those are the 2 most critical populations that we need to be using the phone lines. In the meantime, we're going to continue to ramp up. We're going to continue to ramp up our phone lines. We're going to continue to increase our server space for our system, and to make sure that, more than anything else, that individuals that are approved for unemployment insurance will be able to receive their payment on time. So thank you.
Great, thank you. I think a lot of that is good news, but let me say we will do better. Every day we work to do better. Even in unprecedented times on this, even though it's a volume we've never seen, we know that you are facing uncertain and anxious times, and we will work to do better each and every day. A couple of final points, and then we'll open it up to questions. Beware of scams about testing. and testing kits. Beware of any at-home testing. We don't believe in any of it at the moment. Most likely, it is a scam. Beware of pop-up drive-through testing sites. We have seen a couple that are trying to charge people a certain amount in cash. We cannot tell you the validity of any of them whatsoever unless they are ones that are connected to a healthcare facility themselves. There's certainly one of those in Hazard and one in Louisville and in a couple of other areas, but any pop-up, drive-up testing, I would be very hesitant about. Kentucky National Guard is now being deployed to help at food banks to feed Kentuckians. Deployment is going to help feed seniors, families, and displaced workers. The National Guard members will assist Kentucky's food banks by sorting and packing food into bags and boxes and distributing that through no-touch food distributors. We'll have 70 National Guard members that will be deployed at 4 regional food bank warehouses. Those are in Louisville, E-Town, Wilder, and Lexington. Collectively, the food banks will provide distribution to those at risk for hunger. With that, we'll open it up to about 10 minutes of questions, and we'll go back and forth between the 4 reporters that we've got here in-house and the questions I've received before. Let me start with those. Does the governor plan to implement a requirement to show proof of work to cross state lines? No. We're not going to be issuing credentials. We are relying on Kentuckians to do their duty, to only travel across state lines for the exceptions that we've put out there. Those are to go to work, to care for a loved one, to shop for groceries, or pursuant to a court order. Those should be the only reasons. The state has seen a decrease in referrals and calls to the child abuse hotline since schools closed. Are we concerned about child abuse going unreported during this period? Yes, we absolutely are. We know the most vulnerable are even more vulnerable during this time. So we need those that see it to report it. Remember, reporting child abuse isn't just your moral obligation, it is your legal duty. What can you say to those businesses, particularly those that haven't taken extra steps to protect employees? You have to. You have an order in from this governor, from me, that says that you have to engage in social distancing following the CDC guidelines, even if you are a life-sustaining business. You have to. If there are businesses that haven't taken one step, that is a big problem, and they're going to face big problems unless they start taking those steps and protect their employees. Yes?
The White House projections
Mike.
Up to 240,000 deaths with full mitigation measures. That's a stark number. Can you tell us about the models you're looking at that lead you to believe that's an optimistic scenario?
The question is, we showed the White House numbers on what we would face if there was no mitigation versus if there was social distancing. We see this as a very fast-moving virus, preying on especially those with heart, lung, kidney disease, compromised immune systems. I think it's not just here in our state, but in other states. The heads of public health, the commissioners, and others, see this as an optimistic scenario, and that's hard. That's hard to stomach when you look at some of those numbers. Now, I don't want to criticize the White House for it, because it has led them to take the steps of extending their guidance out through April 30th, and that was a good move. But as we share our modeling, I think it's fair to say that we think the danger is greater than this. But I also believe that our ability to impact it isn't shown in this graph. So this is just kind of the general social distancing that they would expect in the country. I think we can do better. I think we already have orders in place that would lead us to do better. And we could get everybody on board. No more of what I mentioned in Hopkins County with what they're dealing with. That's how you move from the social distancing to the scarier and more deadly graph. If we can get beyond that, if we can prove this weekend when it's beautiful that we are committed, then we can do better, I believe, than any of these models that show social distancing. Joe.
You mentioned the group in Louisville that's doing pop-up testing sites. A lot of people think that's fraudulent or scam. Is any law enforcement looking into actions there? And what specific steps does a company or a group have to do to have a pop-up site? Do they have to go through the state on that?
So the question is about a pop-up site in Louisville today. At least what I read about it was trying to charge $250 in cash. Yes, I believe law enforcement is involved with that, at least initial reports. And I don't know if it was that one or another, because there have been two that have been talked about. One closed down in one location and opened up in another. Any testing that's going on in Kentucky ought to be working with our Department of Public Health. There are regulatory requirements of that. They have to get testing confirmed by it, and our public health should know about any of these that are popping up. Do you want to add? Let's ask Commissioner Stack to come up.
Thank you, Governor. On testing, this is a virus, the treatment is supportive. You shouldn't be handing over your hard-earned and precious money to go get pop-up testing anywhere. The paradigm is what we've said all along. If you feel well and you're not sick, don't get a test. If you think you're mildly ill, you still don't need a test. Stay home, self-isolate, and let the illness run its course if you feel well enough to do that. If you are sick and you feel you need medical care, you have a fever plus trouble breathing or a bad cough, and you feel like you are getting progressively more ill, then go seek care and let a qualified medical professional evaluate you and determine if a test is helpful to you. This is not a situation, particularly when you're facing so many other sacrifices economically, where you should hand over your hard-earned money to go pay someone to get a cash-based test. Please don't do that. It's not going to help you, and it's going to waste your money on a thing you don't need. But if you need care, call by telemedicine or by telephone and seek care from your medical provider. Or if you really feel ill, seek care at a healthcare provider. But do try to call them first unless you really feel you're sick enough to need care. But please don't hand over your money for these tests.
Thanks, Steve. Phil?
You talked about like Lowe's, Home Depot, places like that. I know we've been getting some calls. People emailed me personally wanting to know, have you reached out to the Walmarts, the Dollar Generals, places like that.
Right. So the question is, I talked before about reaching out to Lowe's and Home Depot and talking to them about their crowds, and I do believe we have seen additional steps, and I believe we've seen better compliance, not just the stores trying to push better compliance, but better compliance by people going into those stores. And, you know, yesterday we ended up with 7 deaths, and hopefully that woke people up too. And what we showed today, I know we can take it, but it reminds us that, you know, not obeying not following the guidance can have real ramifications. We talked to Walmart yesterday about the same. They are taking steps. We asked them to take some additional steps, and they're going to do that. Haven't reached out to the Dollar Generals yet. We need to do that, and we'll get on that. A couple more written ones. Does Kentucky anticipate using the use of antibody testing and subsequent plasma donations in preparation for the uptick in severe cases, hospitalizations? I know that there are some healthcare facilities that are testing that now. We still don't know if that is going to be a valid way to fight this coronavirus. We are watching what comes out of the science. But some of the talk about this and some other things is beyond what we actually have the scientific knowledge on. Can the state provide ballpark figures of how much PPE we currently have on hand? We're working on a way to index that on a daily basis. It changes so much on a daily basis, from purchases to donations. I can tell you that right now it is harder than ever to make the purchases of PPE in this country. It is harder to get masks, and it's harder to get other things each and every day. One of our goals is to be out in front of that next part of PPE that is hard to get. Now, let me say that one of the reasons that social distancing is so important is that if we can flatten our curve, if we can stretch it out while other places like New York and New Orleans and others have peaked, there may be the opportunity that there is more availability out there, whether it's for that or for ventilators, if we can make sure that our peak is later and smaller than other people's. So every day that we do what we need to do, it buys us also additional time to make sure that we have what we need. But also it's our challenge. I mean, test kits, swabs, masks, gloves, gowns, they're all difficult to procure right now. And most everything that we see coming into the country is going directly to FEMA, or FEMA is getting. And most orders that we have, even when they are on contract related to the federal government, come in much smaller, even with other entities than we would like. Yes.
Question on.
Hold on. My turn.
Well, come on. Hey, first, yes, it's your turn, but we don't need to be shouting down on each other. We'll all have time.
It's 6 o'clock. So you previously reported the death in Fayette County.
Right.
Can you explain what happened there? But there's, that's part of a regular trend that we're seeing where the states keeping track of cases a little bit slower than what we're seeing elsewhere, and there have been some underreporting and misreporting. What is the process that you have in place for tracking all of these?
Well, the question is on. We were able to obviously announce today that one previous death we'd reported was not accurate, and we've reported some counties that have had that we reported as positive that weren't positive. What we have is we have epidemiologists that gather this information when it's reported by labs or it's reported from our local health departments. But we have how many local health departments? 61 in Kentucky, and that communication is coming in to different epidemiologists. We have over 15 labs that are reporting now, and that comes into our epidemiologists. And they are working shifts and hours that they have never been asked to work before. And we're trying to provide updates every 24 hours. The data we're going to do the best we can with. We're going to admit when there's been a mistake in it, but this is just what it's going to be as we move forward. My goal is to try to be transparent in what we know when we know it, and to provide as much as we can each and every day. We are conducting an audit out of the governor's office right now on the different labs out there and getting their total number of tests that they've done and their total numbers of positives. Again, that information is only as accurate as what we are told, which is one person on the phone talking to another person on the phone. And especially as these rates climb, we're going to see even more parts of the data that we have to change over time. Sometimes we get someone that calls us and tells us that they have a positive case that we haven't gotten in yet. We try to include that in our evening update, and afterwards they call and say, we were wrong, it was negative. That happened with one that we thought was in a nursing home. So we just do the very best that we can, and we'll try to correct it each and every day to give you the best numbers that we can. Mike.
Question on PPE. Many governors have expressed frustration of having to compete with other states and even compete with FEMA. I think I know your answer to this, but do you share those frustrations? And also, is there a better way to do this? Should the federal government step in and purchase these supplies?
It's a two-part question. First, am I, like other states, frustrated by the system where we're having to compete with other states and especially the federal government to buy PPE? Yes, absolutely frustrated about it. I want the very best for our people. I want to have everything that we could need for them. I know that every day that we can't get it, that we're putting people's safety on the line. Yes, it is a major problem, but we are not alone. And so I try every day to just, again, go after that equipment and do everything we can. We're working really three attempted solutions. Number one, procurement. Number two, manufacturing. And number three, donation on each and every one of these. Some are harder than others. The respirators, the N95, the procurement is incredibly difficult, as is the manufacture, because it's under patent. I'd like to see the people with that patent, which is 3M, provide that to the nation under a license for this period of time. I believe it's their patriotic duty, and they should put it out there so everybody else can manufacture it. That hasn't happened. Donations, we've mainly had donations of industrial N95 respirators. They're not as good, but we will take everything we can. As you move down right, in things like gowns or face shields, we have better opportunity there on the manufacturing side. And as you get to things like gloves, we have a lot more opportunity on the donation side. So our goal is to push in all three of those areas each and every day. Do we know how many healthcare workers have been tested positive? We don't have a specific number on that. I believe it's more than 50, given some of the numbers that have come just out of Louisville with the other cases that I know that we have seen. With it being the first month, with not only rent but other bills due, can the governor provide any guidance on what assistance is available and what people should do as they await unemployment and the federal stimulus? Right now, during this period, you cannot be evicted. Don't let anyone tell you that's possible. If you are threatened with eviction, it is illegal right now in the Commonwealth of Kentucky to evict you for failure to pay rent. Now, with that said, if you can pay rent, do pay rent. That's important because everybody that owes rent is still going to owe rent once this is done. We're working to speed up that unemployment. The federal government has added $600 per month. It's important to know that those obligations will still be out there. Our hope, given this is a worldwide pandemic, is that tenants and their landlords can work together to come up with a way to where we can hopefully make everybody whole, but everybody get through this over time. Joe?
I have another PPE question. Have you been told by White House or federal officials that the strategic national stockpile of PPE is nearly empty? And also, can you say what percentage of what you requested was actually received from?
It's a two-part question. The first is, have I been told that the national stockpile is nearly empty? I've not been personally told that. And I haven't been on a call where that was conveyed. And the second is, can we give a percentage of what from the national stockpile versus that we requested versus we received? Let me get that for you. I want to make sure that's accurate. I don't have that in front of me. We get much less than we ask for, just like everybody else is getting much less.
The Washington Post reported that you got more than you requested. Is that false, or is that true?
Oh, we've made request after request. No, we have certainly not gotten more than we requested. We at one point got a shipment that was helpful, but much less than we would ultimately need. But we and every other state are making requests each and every day, and not to pile on the federal government again. 4 months ago, none of us knew that we would face something like this, and so I believe everybody is scrambling right now. Do you have a comment on the study from the University of Washington that attempts to project the number of hospital beds that will be used and the number of deaths in Kentucky and other states at the peak of the COVID-19 pandemic? I want to wait until we're able to present our modeling. I believe if we compare the White House's assumptions versus that the White House's assumptions are higher. I believe in what we saw as what we could see at a peak in terms of deaths in Kentucky. In terms of beds, I believe our projection will be that we will need more. And that's why we have worked to increase that 18,000 and change hospital beds to at least 8,000 more that we believe that we will be able to deploy. And I will tell you, I want to make sure that we can have more than that. I was wondering if you can give me an update on the status between the State Health Department and the University of Kentucky to produce some specific modeling. We are still working on that, and we hope to be able to provide that information soon. Is the Department of Corrections aware of any other inmates or DOC staff that has been tested or would have tested positive for the coronavirus between what was reported on Monday, which was the one inmate at North Point, which I believe is tested negative? Our North Point test is negative. And Green River. So in Green River, we have 4 folks that have tested positive, all of which are either administrative or health. One of the healthcare workers was exposed to a certain subset of the inmate population there that are all quarantined in a specific part of that facility. None of them are showing any symptoms as of today, but we'll be monitoring that, and if there are other positive tests, we will report it. Can we confirm any COVID cases at Western State Hospital in Hopkinsville? I believe we have one confirmed case there. I don't have any other details on it, but I believe that we have one. I have a question on GE. I will say that we've been in communication with the mayor's office in Louisville and their Department of Public Health. Their Department of Public Health, we're told, has been out a couple times working directly with GE, and we are watching the progress and progress that we hope is being made there and can be reached between the workers and the company. Can we get an update on the Campbell County Nursing Home? I do not have an update on that one tonight. We will take just a couple more questions. Daniel's right, it is past 6.
There are reports, sorry, we're drinking the Bevan area, got a question. Reports of out-of-state license plates in the east, and have local officials in local state parks asked you to shut down the state parks? As, you know, there's been these concerns about people.
The question is, there have been reports of out-of-state license plates in the east, though I will say we also have it in the west, and I have been asked by local officials to shut down state parks. I believe there's been one instance dealing with a state park where there's been a recommendation made to us. But county judges have absolutely expressed to me their concern that people are coming in from out of state, and we have talked jointly about different things that we can do to prevent both that travel and the reasons that might be behind that travel. I believe that there's a turkey hunting season that's coming up, as well as different areas where people are congregating that we are working together on to make sure that we are shutting down that ability to congregate. And right now, I know with this fear, we focus a lot on folks from out of state, and you hear New York, or you hear Louisiana, or you hear Florida. We shouldn't have anybody congregating, right? We should be just as worried about any other Kentuckian that's coming together in a group like that. And I will tell you that this is a moving target, and I'm glad that we hear about those concerns, because it means our local leaders are really engaged, and they are. When I say there aren't Democrats or Republicans, they're just Americans versus the coronavirus, I see it in those calls. I see it in their actions. I see it in their concerns. We have a lot of really good leaders out there that are really focused on this. Let me take one more. Phil.
Some of the other states are basically a blanket stay-at-home. Are you considering anything like that as well?
The question is, some of the other states are a blanket stay-at-home. Are we considering that as well? I believe when you actually look at the orders from those states, what you will see is the exceptions that they have are the same ones that are really allowed by our orders. The only thing that we're not doing that a couple of states are doing is claiming that it's a misdemeanor to be outside of your house for any but a couple of reasons. That's not how we get where we need to go. We believe that our healthy at home model, and healthy at home is what we should be. When you say this term, shelter in place, it's like you're hunkered down in a way that is not going to be good for your physical and emotional and mental health. Healthy at home talks about all the things that you can do, not just what you can't do. It's the ways that you can reach out to people through digital and other means. It's the things that you can go do, like your grocery shopping and getting physical exercise. I believe that we have some of the most aggressive steps that we have taken, but in looking into the future, if we have to take additional ones, we will. But the only way we truly get where we need to go is because the people of Kentucky are fully bought in and are willing to get there. I want to thank everybody. We did go about 15 minutes over today. I appreciate you sticking with us. We are all in this together, and we're going to get through it together. And today's a special day for me. It's my wife and my 14th anniversary, and we are spending it healthy at home. I know a lot of you have had special dates that have come, whether it's birthdays for people you can't see, whether it's birthdays for your kids that their grandparents or extended family can't come in. We are all making sacrifices because we are all protecting the people around us. We are ready for this challenge. We've got to be committed to doing better than any and every model that we put up there. We are all responsible for our own actions, and it's our duty as Americans and as Kentuckians to protect those that are around us. I have one last video I want to play that I want to leave people with. And these are a couple of kids filmed by their parents that get what's going on. And I want you to watch until the end, because I think it's the last line that's so incredible how this kiddo gets it. Thank you all very much. Thank you, Virginia. Thank you, James.
And if we can accomplish this, we will have history in it. And since I am 6, it'll feel like I am 4 or 5. And I'm 4. And if we feel like giving up, we do not. No, not at all, no. And if you ever feel like giving up when you're trying to do something you really want to do, don't give up. Because I know deep down inside of all your hearts, there is a way to accomplish everything. And we are the future people. If we can do this, anyone can.